If I told you to run a marathon, would you just show up for it without training? No, you would train for it for months. But every day, I see older adults walking into a major surgery, which puts the exact same stress on the body as a marathon, without any preparation at all. Surgery isn't just a nap, it is a metabolic storm. It involves blood loss, inflammation, and puts a massive stress on your heart and kidneys. And if you go into that storm naked, without protection, the recovery won't just be slow, it might be incomplete. Here's what happens when you get older. When you're sitting on the couch watching TV, your body looks fine, but your organs are like an old rubber band. At rest, it holds together. But when you stretch it, like during surgery, the hidden cracks appear. The ability to stretch and not break under tension, we call this the physiological reserve. Young people have a lot of it, and as we age, we lose it slowly. And when you run out of reserve on the operating table, complications happen. This is why we need prehabilitation. Look at this line. The blue line is standard of care. You start here. Surgery knocks you down deep into the danger zone. And because you fell so far, you struggle to climb back up. Now look at the green line. This is prehabilitation. We train you before the surgery. We boost your health up here. So when the surgery knocks you down, and it will, you land on the cushion, not the concrete. You recover faster and have less complications. So how do we build that cushion? We focus on 4 pillars. First is muscle. Muscle isn't just for strength, it is your body's protein bank. When you are healing a surgical wound, your body needs raw materials. If you don't eat enough, it will eat your muscles to survive. We need to fill that muscle bank. Do you have enough deposits? Let's try the finger ring test. Wrap your middle finger and thumb around your calf like this. If your fingers overlap, your bank is empty. You are in the danger zone. We need to build you up. Second is fuel. You cannot build a fortress on just biscuits and tea. As we get older, our bodies become less efficient at processing protein. So my prescription? A palm-sized portion of protein, be it eggs, fish, tofu or chicken, at every single meal, breakfast, lunch and dinner. Third is the engine, your heart and your lungs. Surgery increases the oxygen demand on your body massively. If your engine is weak, the system fails under stress. You need to train your heart to pump efficiently. Now, I don't mean you need to run a marathon, but a casual stroll in the park isn't enough either. We need to hit the sweet spot. And how do you find it? Use the talk test. Go for a brisk walk around your taman. Walk fast enough that you feel warm and a little breathless. The rule? If you can sing a song, you're walking too slow. If you can't speak a full sentence, you are going too fast. You want to be in the middle, breathless but still able to chat. Do this for 20 minutes a day. We are tuning the engine so it doesn't stall during the race. Finally, the command center, your brain. This is the most overlooked pillar. After surgery, many older adults suffer from delirium, which is a sudden state of confusion. It's terrifying for the family and dangerous for recovery. To fight this, we need to build what we call the brain reserve. We do this in 3 steps: by getting information, by doing novel things, and by relaxation. The first step is to gather information. Fear comes from the unknown, so ask your surgeon or the nurse for a walkthrough. What exactly will happen when I wake up? Will I have a tube in my throat? Knowing the roadmap takes away the shock. The second step is novelty. You need to challenge your brain before surgery. Your brain is like a muscle. If you only do the same easy routine every day, it gets weak. So do something new and difficult. Brush your teeth with your non-dominant hand, learn a new card game, take a different route to the supermarket. This novelty creates new connections in the brain, and this builds a buffer against the post-operative confusion that I was talking about. The third step is relaxation. Anxiety releases stress hormones called cortisol, which can destroy muscle. We need to turn that off with the 4-7-8 breathing technique. Let's do this together. Inhale through your nose for 4 seconds. Hold that breath for 7 seconds. 5, 6, 7. Now exhale forcefully through your mouth for 8 seconds. Do this 4 times twice a day. A calm patient heals faster. So let's review your training plan. Fill your muscle bank. Eat your protein. Pass the talk test. And challenge your brain. You might be thinking, Dr. Lim, I don't have cancer and I don't need surgery. Do it anyway, because the aging process itself is a slow stressor. Don't wait for the diagnosis to put on your armor. Build your reserve now, so that when the storm comes, whether it's a fall, a flu or surgery, you are ready to weather it. Start training today. I'll see you in the next video. Bye.